From the beginning, this is what attracted us to the AssureCare platform, that this idea that it's a patient-centric platform that connects payers, providers, and patients. And it's important not only for our strategy, because at Kroger Health, care is interprofessional, but it's important on a tactical level. I'll give you some examples. Our pharmacy teams often are treating patients with diabetes, and we developed an interventional program that helps support patients with diabetes with both our pharmacy teams and our dietitians. So pharmacists are able to identify people who may need support to control their chronic disease, and if they don't have a dietitian serving them already, refer them to a dietitian. And that's all powered by technology. Also, our clinicians within our clinic are supporting people with weight management. And when people choose, they refer them to a dietitian within Kroger Health. And it's the technology that connects those parts of our business and enables us to not only make referrals, but share care plans, so we can collaboratively care for patients for the long run.
At AssureCare, we're using technology to make nutrition more personal, measurable, and scalable. Instead of generic plans, clinicians can build customized care that fits each patient's life and track progress to support them in real time. Our technology also makes care more connected. When nutrition data flows between patients and healthcare providers, outcomes improve. Interoperability has long been prioritized in other healthcare disciplines, and nutrition is finally catching up. The infrastructure is here, the urgency is real, and we're ready to meet this moment.
Especially in healthcare, no one company can do it all on their own. So we look at a company like AssureCare, a true innovator in technology, as being a key component of accelerating our strategy. Their platform allows us to leverage both real-time information as well as assessments in order for our dietitians, our physician's assistants, our pharmacists, our technicians to have data at their hands in real time so that they can have meaningful conversations with our patients. We've been able to integrate the AssureCare platform directly into our workflow, both with our dietitians and our pharmacists. This really has allowed them, our pharmacists and our dietitians, to interact with it just seamlessly in everyday work and not be one other place they have to go to do something. So it brings the clinical work, the clinical decision making, and the assessments right into their everyday workflow, which is critical for us, especially in the world of retail pharmacy. It's important to be efficient so that you can take care of customers. Some customers and patients are there to get a prescription and just get home, and others are truly trying to learn more about a disease state.
So today's pharmacies are more than just a place to fill prescriptions. They're a trusted health access point, often one of the most frequent touch points the patient has with the healthcare system. And in a grocery-based environment, that access is uniquely powerful because there's opportunity to positively impact both clinical and nutritional components of disease management. So there's ample evidence for the positive impact of pharmacists on patient outcomes, on cost and access. We saw this most recently with COVID as retail pharmacists stepped in to deliver over 40 million vaccinations in a single year. So more and more we're seeing this shift to leverage pharmacies for services like immunizations, medication management, chronic disease monitoring, and screenings.
Over the past few years, we've been able to complete over 10 million interventions on the AssureCare platform. And that's really allowed us to allow our pharmacists and technicians to practice at what we say is the top of their license and really truly change behaviors for our patients, whether that is closing gaps in cares with vaccines, getting people on appropriate medications, improving medication adherence. This is all a core component of improving outcomes in healthcare, which is a key part of Kroger's overall mission. When you think about connecting to payers, really having all of that data at hand to be able to showcase what you are doing for patients and for health plans is critical for maintaining those relationships.
It's been helpful for the platform to enable our pharmacy teams and dietitian teams to engage with patients in everyday workflow. And it's also a powerful assessment tool where we can identify patient-specific barriers to things like medication adherence and then report on those issues. And when we intervene on something like medication adherence that's highly complex, we also are able to address those specific barriers for that patient because everybody's got different issues that they're dealing with. Some are dealing with issues with cost, with remembering to take it with transportation, coming to the pharmacy to pick up their prescriptions, and what that person's individual barriers are is what we want to address. And so payers are very interested in that type of information about their population so that they can better support their members, and we can better support our patients.
Pharmacies are closing care gaps right at the point of care that directly improve STAR measures, HEDIS scores, all while generating new revenue streams, improving patient care and satisfaction. And this impact becomes even more powerful as we layer in nutrition. With integrated nutrition tools like food insecurity screenings, healthy eating assessments, meal planning support, and grocery-based dietitian consults, pharmacists can deliver whole patient care. And because it's embedded in the same workflow, pharmacists and dietitians can collaborate in real time. And it's not just about outcomes. These services foster loyalty, they build brand trust, and they differentiate the pharmacy as a true care destination. Expanding clinical services and nutrition support turns every pharmacy visit into a health opportunity. And AssureCare helps make that transformation scalable and impactful every step of the way.
The seamless integration has been huge. It's amazing to see the transformation over the years since we've implemented the platform, because now when you are in our pharmacies, they don't refer to it as anything separate. It's one system and it feels seamless. And that's important because pharmacists are busy, and anything we can do to make it easy to engage patients about their own health is going to make us more effective. So we engage people about vaccine gaps or medication use gaps in care, offer a CMR, and all of that is present within workflow in a way that makes it more approachable. So we can be more effective when we make it easier, and that's what the seamless integration has done. But I'd be remiss if I didn't mention that this system has also enabled pharmacists to provide services that advance their scope in states where it's allowed, doing things like test and treatment services for strep, flu, or COVID-19. And to perform those services, to engage patients and support our communities that way has been a big benefit. We have a primary care shortage in America, and patients have trouble accessing that type of care, and it's something that you need very timely. When you're sick, you want to feel better. So having a platform that supports us in documenting those types of services has been a real benefit.